Hi, my name is Dr. Stephanie Pierce. I'm the Director of Sports Medicine for Nemours Children's Health in Jacksonville. I love working with my hands. I love building things, finding solutions to problems. And so it was a natural inclination to come into orthopedic sports medicine. That full spectrum of getting to meet the child and the athlete where they are and find their goals and see how we can get them back to the goals and back to the activities that they want to do is something that brings me a lot of fulfillment and joy. My area of expertise is located to the knee, elbow, shoulder. I am both dual trained in adult sports medicine as well as pediatric sports medicine surgeries. And so that brings a really nice combination to be able to connect with our athletes at any stage of their growth. There are very unique things that happen to our young athletes that are growing. There are also considerations to have as the growth plates are closing and we're moving into more adult statured positions. The closer need for cartilage, the loss of the ability to regenerate and to remodel. Those are all critical pieces that I clue in and bring together from the adult sports training as well as from the pediatric sports training to give these patients in this transitional period the best care that they can get. One of the main things I like to focus on with our sports medicine division is communicating with the patient's physical therapist as well as with their school athletic trainers. And when the four of us come together to be able to communicate and create a patient-specific plan for each individual patient, injury, and goals, that's where we can really bring the next level of care in sports medicine to our athletes in the area. There's been a lot of move to incorporate females into a variety of different athletic adventures, and with that comes very unique injuries and treatment needs for each of those injuries. Any way that we can get the patients back to being able to hit their activity levels, to be able to hit their goals, to be able to go from day-to-day activities to the most elite type of sport performances, even if it may look a little different than how they used to think about doing it, is certainly a way that I want to reach the goals of our patients. The number one thing I want my patients and families to know that when they come to see me, we're going to be working together side by side as a team to find and realize the goals and try and get the patient and the athlete back to those goals.